Single city council across our entire county has someone like Aaron Edwards that is passionate about this cause, that isn't afraid to ask hard questions, is creative and innovative, and then also bold and daring enough to join our Continuum of Care Board of Governance. And you know, I will say, Councilman Edwards, you have always asked the right questions, and you know, I often know that when I prepare for these, I think of you and I try to predict, okay, what is she going to ask? You know, what are some things that she's going to raise? So we thank her for her many contributions. In regards to when elections will begin, in the next couple of weeks, we will be sending out nominations for each of the seats that were just highlighted. We would strongly encourage our existing Board of Governance members who occupy these seats to consider rerunning. You have all been invaluable. I know I speak on behalf of our entire staff in sharing that we have enjoyed working with you. We have learned through you, and you have influenced all of our programs. And so there's no reason why you cannot self-select to run again. Once the nominations are announced to the Continuum of Care members, then we will tally up those nominations, confirm that each person nominated is interested, do a formal presentation to the Continuum of Care where we would invite you to come in and speak and share why you are interested in running. And then following that meeting, a formal ballot will be sent out. With that, I'll go ahead and end that update and be available to answer any questions.
Thank you, Tanya. And I also want to add my disappointment that we're no longer going to have Councilwoman Edwards with us, because I totally agree. I didn't know you before working with you on this board, but since I have you have earned my respect, and your questions have always been spot on, and you have contributed so much to this group and to the people that we are trying to make the difference for in this world. So thank you so much for everything. And yes, you may.
It's probably easier to do this one. Thank you. I don't even know where to begin. I'm just like speechless. It is not just a huge loss to this Board of Governance, but you are, I like to use the term Dragon Slayer. You've heard me say that. And what you have done with your leadership and your compassion and your advocacy in the city of Riverside is unprecedented. And you have big shoes to fill. And I hope somehow, some way we can still keep you involved, because you truly have made a difference with all of your policy work. And I know you have a beautiful family and probably other things I get choked up to focus on, but we love you, Aaron. And I don't know how to thank you for everything you've done in this space for the people that we serve. So, yeah.
Thank you, Karen and Letty and Tanya. And I will say one of the saddest pieces of choosing to step down from the city council role was knowing that, or learning that I wouldn't be able to continue on the Board of Governance here, because I was hoping that there would be a way to continue. But I do hope that we can find a way for me to stay involved in the future. And it's been wonderful to learn from you all and serve alongside you. So thank you for your kind words.
Thank you. Thank you, thank you, thank you. Okay, we will move on to the next item on the agenda is the consent items. Is there a motion to approve the consent items as submitted? We have a motion. Is there a second? We have a motion and a second. Is there any questions? There being no questions, the vote, please. Do we have to do by vote, or can we do all those in favor since we're all present?
You can do all those in favor.
All those in favor, say aye.
Aye.
Is there any noes? Any abstentions? There being none, it passes unanimously. We will move on to the next item on the agenda is public comments. Mariel, do we have any member of the public that would like to make a public on an item that is not listed on the agenda, and they would have 2 minutes to speak?
We did not receive any via email. We do have Michelle Davis on Teams with her hand up.
Okay, very good. Michelle, please.
Good morning, everybody. I just want to, I have to make my 2 minutes quick, but we're going to miss you, Councilman Edwards. You did a lot for the city of Riverside and our constituents, even our homeless population, and advocated for a lot of our affordable housing projects and homeless programs at our Housing and Homeless Committee. So we will miss you as well. I just want to say yesterday, or actually it wasn't yesterday, Tuesday, City Council unanimously approved a disposition and development agreement for the Sunrise Park, which the county does have some HAP funding within that project. So we are looking forward to that project moving forward. So I want to thank our new city council members that fully supported that project, and that will be providing 23 permanent supportive housing units in the city of Riverside. We also, next Tuesday, will be taking to city council a pilot program, which is a supplemental senior income rental payment that will help seniors that are first at or over the age of 70 to help them with trying to remain in their housing while we're trying to get them into whether it's Section 8 or affordable housing within that 12-month period. If the need is greater, we will reduce that age limit down to 62. So we'd love to hear some of our members here show up, or if you guys provide some support through public comment, that will be next Tuesday in the evening session. So I will put in the chat box a link to that as well. And thank you for allowing me to provide some public comments.
Thank you. Is there any other public comment, Mariel?
Yes, I just received that we have Karen Young Lowe sent in the request via email, but she's also on. Karen, if you'd like to speak.
Yes, good morning. Thank you so much. I will very quickly speak. And if the board has already and the COC is already addressing this issue, I apologize if I haven't heard about it. But I did just want to bring this to everyone's attention. I think that you probably already know this, but in July, on July 1st, our governor will no longer, as housing providers, be able to provide a double deposit to our landlords. And this is going to be I think, a very serious issue to those of us who are housing folks that have significant barriers. It's been a tool, that we have utilized in order to be able to house folks, especially in rapid rehousing services. So I haven't heard, any plan. This is really something that is just affecting California. And I really do have some concerns. I don't know, maybe our policy wing, is already looking at this and kind of, thinking about what we're going to do, as housing services providers. So I just wanted to kind of bring this up. I know we can also talk about it certainly in our COC, and I'm happy to also bring it up there. But I did want to just, kind of put this on our radar if it hasn't been placed on our radar, because I haven't heard anything from HUD. And I think that we do need to kind of be thinking about, what our plan is going to be, because I do think that this is going to affect us going forward. And it is coming up very soon, as of my understanding is July the 1st, unless maybe I'm wrong, maybe something has changed or something has been done, or maybe we have a plan that I'm not aware of, but I did want to bring it to the board's attention. Thank you so much.
Thank you, Karen. Okay, this was a public comment, but that is a very important topic. And if we could direct staff to come back at the next meeting to provide us with some information, and maybe there's some other items on the governor's plans that we need to be aware of and to act on. Okay. Thank you. Is there any other member of the public? Please step forward. Thank you.
Hi there. I just wanted to introduce myself. My name is Greg Koffos. I am the Director of Veteran Services for the County of Riverside. Very excited to be here for the first time in this role, and Just want to let everybody know that, we're trying to kind of get out of our box at Riverside County Veteran Services and expand our services and expand our thinking. And so I'm looking forward to the partnerships that we can create with all the housing agencies, all the social service agencies in the county. And please just, don't hesitate to reach out. My email is gcoffos, that's GCOFFOS @rivco.org. And I look forward to partnering and just collaborating with everybody and doing better things for our veterans in the community.
Thank you so much for attending today. We appreciate it, and it's nice getting to know you. Is there any other member of the public that would like to speak? Okay, very good. We will move on to the next item, which is 4.1, YHDP Coordinated Community Plan. And I will turn it over to Amy Primrose Puente, who will inform us of this item.
Good morning, Board of Governance members. My name is Amy Primrose Puente. I'm a Senior Program Specialist at Housing and Workforce Solutions, COC, and I'm here to discuss item 4.0 on today's agenda regarding the Youth Homelessness Demonstration Program. In September 2023, HUD awarded Riverside County COC with the Youth Homelessness Demonstration Program grant in the amount of $7,487,462. The goal of the Youth Homelessness Demonstration Program is to support in the development and implementation of a coordinated community approach to ending youth homelessness in Riverside County. Excuse me. The first step to receiving YHTP funding is the creation of a coordinated community plan, which identifies the unique needs of our county and outlines actionable ways to address them. Since being awarded, Continuum of Care staff, Youth Action Board members, and an array of community members and HUD technical assistance reps have been working diligently to create our Riverside County CCP, as we call it. The Youth Action Board, which is comprised of 18 young adults between the ages of 18 and 24, with lived experience, took the lead in shaping the discussions on establishing a youth system of care in our county. They also played a leading role in the creation of the Coordinated Community Plan, or CCP, including the mission and vision statement, contributing to the statement of need, establishing the governance structure, and actively participated in the selection of the youth projects to be funded by YHDP. If you'll please turn your attention to the slides. Oh, over here to our left. You will see our project list, and we have 31% of the funding is going to permanent housing in a joint transitional housing rapid rehousing model, which is really cool because it is cool. It's really cool because it takes housing crisis and rapid rehousing. So when we encounter youth on the street, we're able to scoop them up and get them somewhere safe immediately while they're bridged to rapid rehousing. So I really like that model a lot. And then we have permanent supportive housing, 9%, transitional housing, 10%, youth navigators, 5%, drop-in centers, 8%, supportive services only is 17%, planning grants, 10%, and then project administration, 10%, which comes to 50% allocation to housing and 50% allocation to supportive services. This was also a HUD mandate and this is the first round of YHDP that HUD did this, that they said that 50% had to be allocated to housing, which we loved, and we wanted to, we even wanted to go higher than that, but we know that we can't house folks without the supportive services. And HUD also had us account for the staffing, so that came into supportive services as well. These projects will create 60 to 80 new beds for youth with the capacity to serve 250 unduplicated youth that will be connected to housing resources in our larger system of care. The next slide, we'll see the timeline for our RFPs for our request for proposals. We anticipate having the bid application released by April 26th, next Friday. The bid application, or the request for proposal rather, will be open for 30 days. And awards will be posted to HUD by July 1st, and anticipated projects to begin by October 1st. So as the collaborative applicant, the COC has until May 20th to finalize the coordinated community plan, which is now in its final stages. We anticipate having it submitted to HUD next week, although we have until May 20th. While YHDP funding is operated as a HUD COC program, the funding is unique in that it provides special YHDP activities and projects to address the specific needs of youth experiencing homelessness. Additionally, HUD also mandates having youth representation in all facets of the funding process. Excuse me. Riverside County's Youth Action Board will take part in the request for proposal process as evaluators for the independent review panel. They won't be the only evaluators. It'll be a mixed panel, but they will participate in the review panel, and will thoroughly be trained on the process by our HUD TAs. Have a training to kind of just an overview of what the bidding process looks like, and then the COC will train them thoroughly on our particular process and how to be evaluators. In response to HUD's recommendations, acknowledging YHDP's youth-led focus and the expertise and perspectives of young adults impacted by youth homelessness, the recommended motion is to allocate 2 designated youth action board seats on the Board of Governance for youth to participate and vote on YHDP and youth-related matters. The COC and HUD technical assistance reps will also provide training around the duties these respective seats hold and on the informed decision-making process. So thank you for your time and consideration, and I'll stay up here for any questions.
Thank you. Do we have any questions from our board? Very good, starting with Karen.
Amy, great job.
Thank you.
I'm super excited to see this whole initiative roll out, and I can see that all of the feedback that you all have received from the community has really helped to contribute to some amazing strategies. I happen to love that blended model of, if I understood it correctly, so help me understand, where you could have TH and permanent housing all together. And I have seen other best practices like that, where you could have an apartment complex and the seats, the rooms can be rotating, or they can say, I'm in transitional housing, and then after so much time, it becomes a permanent housing unit. And it's really wonderful model for youth. So I'm super excited to see that level of percentage of funding being allocated to that. And I wanted to also, I've made a plug before, but I want to say it again, to the extent that we can do everything possible. And I know through the community outreach and the meetings you all have had, that we do everything possible to engage and support the colleges, the community colleges. We are helping a lot of homeless youth, even just in, my part of the county, and there's a huge need for the TAY population that are homeless at the colleges. So I'm excited that hopefully some really cool partnerships are gonna ensue as a result of these funds.
We're in the works of getting our colleges in. Part of that money is also going to be, a percentage of that allocation is also going to be targeted for higher education partners only. So, so we hear you, and we're working hard on it. And
a good model, I think, would be so the colleges can focus on education. Absolutely. To partner with expert providers that already know how to do sheltering, transitional housing, and permanent housing. It's like a marriage made in heaven, to be able to really help move the needle in that. So just that's a couple of my things that I just wanted to throw out there. I had a clarifying question, because I am super excited about the youth seats on the board. I think it's absolutely critical to have a loud voice for they are the future of tomorrow. At one point I was, pushing, because we have Monique, who's part of the HWS team, who is another dragon slayer as far as I'm concerned in terms of the work that she's done in this field. And I wanted clarification because I didn't know if she's part of that and she could be one of those seats, or are you looking to have just youth that are a part of it? So could you clarify?
Sure. So the Youth Action Board members are members with lived experiences from ages 18 to 24. So Monique is a past Youth
Okay.
Action Board member. And
Okay.
so now she is our youth coordinator. So she's like, she leads the Youth Action Board now, or guides them rather. So she will absolutely help train the Youth Action Board members to be in this seat because she held it at one time before. So she has a lot to give back. So she's going to be an integral part of the training process.
Well, I'll just make
And the
one
guidance
last comment
process.
and then I'll stop. I think knowing just our experience with the youth, sometimes when they're around other people that have been in this space a long time, they might feel a little bit shy or intimidated. And I think
Absolutely.
the opportunity to have two youth where they can, strengthen and support one another,
Yes.
learn, be a little bit more brave to
Yeah.
speak up and be a part of it, I think is an important thing for us to be doing. So I just want to thank the staff for proposing this recommendation.
Thank you.
Thank you. Erin?
Thank you. I echo the enthusiasm for adding the seats to the board. My only question is, if I'm understanding the presentation and the report, they would only be attending and voting on youth-related items. And I'm curious how that decision was made and if there's any interest in having them participate in all of the meetings, because certainly their perspective would be helpful on all of the issues before the board.
Yes, so that recommendation actually came from HUD, just based on their work with communities that have received YHTP funding. As you guys know, this is now is it fourth or fifth round?
Seventh.
Fact check me. The seventh round. I'm so off, but not always. I'm not always off. So it's the seventh round, and so this has been sort of replicated across counties. I think that. Right, we're moving forward on this recommendation, but also looking at some of our past experience. We have had a dedicated youth homeless seat on the Board of Governance, but have had just difficulty getting someone to participate full time. And I think it's, for us, it's a reminder that they want to be at the table, but they are trying to balance between work, school, housing. The time of these meetings often makes it difficult for them to attend. We are very fortunate that with YHTP funding and part of the 10% set aside for planning, I really wanted to emphasize that's going towards providing stipends for youth so that when they participate in these meetings and all the other CCP planning meetings, there's been over 24 that have occurred just in the last two months, that they get reimbursed, and that includes like mileage reimbursement, gas reimbursement as well. So it's based on a HUD recommendation. We do currently still have a vacant youth homeless seat that we're working to fill as well.
Well, I wonder if there's an interest in adding to the motion, given that recommendation, that this be reviewed after a year, and then at that time consider if the position should be extended to full-time membership and if the data supports that.
So we'll consider that as part of, if somebody is wanting to make that change to the motion when we get to that point. Is there any other member? Oh, Angelina?
So just to clarify, since there is already a vacant seat, would then that be one additional seat or would it be three?
I misspoke. It would be 2 seats.
Just two.
Yeah, 2
So-
seats total. Yeah.
And in relationship to quorum, since they're really only going to attend certain meetings that relate to youth, it won't impact full quorum if they're not present at every meeting, but it would impact quorum if they're not present at those youth-related meetings. I just wanted to clarify that for everyone.
That's a good point.
Okay.
Good point.
And I think this is great, and I'm really excited that the component of the training is in there because I was part of the lived experience groups concern is adding lived experience individuals, especially youth, to an entity like this. It is very intimidating. If you look across this table, you know, it's intimidating. I mean, it's a seat of authority. These are leaders that have been doing this for a really long time, or I can speak for myself. I've been doing this for many, many years. And I know when I was 18 to 24, I may not have had the same confidence that I have now and be willing to have that voice. I've always been outspoken. Sorry, that's never changed, even though I'm an introvert. But I really think it's a great idea to help them understand what is the role, what is being asked of you, how does this work, how does your voice matter, and when to speak up. And even if you're a little scared or intimidated, it's important to bring up those questions and those perspectives, because somebody may be having those same questions and not ready to raise their hand. So I'm really excited about that component, and I'm really excited that Monique is going to be a part of that, because she's just amazing. And yes, I agree, she's total Dragon Slayer material through and through. So thank you very much.
Thank you.
Any other board member have any questions or comments? Okay, yes, Carol?
I was wondering how you've incorporated foster youth into this initiative. It seems like there's a lot of that population out there too. So just curious how that was going to be a part of the plan.
When I say, well, first off, the Youth Action Board members, many of them, when I say lived experience, many of them have been part of the foster youth system. But additionally, the YHDP is targeted for people with lived experience who have, and most of, not most, but many of them have been part of the foster care system. So it incorporates the large picture of youth homelessness. Everybody. Did you want to add something to that, Tanya?
Well, just to, I think it's always important to acknowledge the many partnerships that come together as a result of programs like this. I will say that at many of the planning events, we had children's services social workers in addition to foster family agencies who brought their youth and their young adults to the meetings. So they have been very involved in helping us plan and develop the CCP, which we will forward to you in the entire continuum of care for review and feedback as well.
Thank you.
Any other board member have any questions or comments? Okay, I do have a couple of questions that are probably very simple, but just to clarify, on the proposed project, the breakdown, planning grants, 10%. Those are grants that we would be offering to the organizations, or what is that?
No, thank you for clarifying that. As I mentioned earlier, YHDP is operated as a COC program, but it's unique. And one of those unique factors is that they gave us an option of 10% of the grant to be used on planning activities, which is youth compensation. And so 10% of those funds are going to compensate our youth for the next 2 years.
Excellent, thank you. And the other question that I have is on the RFP. So the timeline then is that it closes, it opens on April 26th, open for 30 days, and then the awards are posted on July 1st. So that's a really quick turnaround.
Yes, ma'am.
Okay, and that the decisions for funding that will be made by staff based on criteria, or they don't come back here?
They will come back here. After the independent review panel, we're going to have to be working fast in May.
Okay.
We're going to have, and in June, sorry. We're going to be working really fast. But after the independent review panel presents their recommendations, we'll bring the recommendations to the Board of Governance.
Okay, thank you.
Yeah.
And my last comment is the idea of having a youth member participating at all times. As we consider this, if there is going to be a change to the recommended motion, that, times have changed. Now we are able to use technology to help us connect with more people. So maybe that component might be able to be a benefit to a youth that is working or going to school and could join remotely. So
That's a good
just that
point. That's a good
idea.
point.
Okay, so is there a motion to, on this item? Is there, I'm sorry, totally forgot. Is there a public comments?
Yes, we do have Monique Guerra.
Okay, very good.
Hi, everyone. Can everyone hear me?
Yes.
Yes.
Thank you. No, I just wanted to uplift all the support is much appreciated. Hi, everyone. I'm Monique Guerra, Homeless Youth Coordinator with our COC. Thank you all so much for your comments on this item. And I just wanted to uplift that there are YAB members on the call who are experiencing the Board of Governance meeting probably for the first time. And so it is very new. And while being in this space can be intimidating, I think it calls for a partnership, right, between Board of Governance members, right, possible mentorship for our YAB, and I think giving them the ability, right, to be on this board and speak on items outside of youth-related items to broaden their scope as well should be something that we can consider for the role in the future. So just, I know YAB members were on, so this is kind of the item that we were discussing during YAB meetings, and so it encourages our discussions during our Youth Action Board meetings as well to talk about, well, what does the YAB want to do in this role and what are they comfortable with? And I know I saw another comment from Ree, who is our HUD TA. I'm not sure, Mark, can I pass it over? Thank you all.
Thank you, Monique. Another speaker?
Yes, Ria Zom Morris.
Hi, all. I'm Ria Morris. I am one of the HUD TA that's been working alongside your incredible YHDP team. I said it in the chat and want to say it out loud. Throw them a party, y'all. The work that they have done over the last few months and are going to be doing has been phenomenal. And we've been very, very honored to work with them. I do want to echo what Monique was saying. I think typically, national best practices would be eventually you're looking at having youth seats that are voting on all topics, because we want, right, like the idea of a seat at the table is that folks have a voice in how your system moves, how it navigates, what decisions are made. Definitely respect that. It's a very new thing you are contemplating in this motion, and I think it's a wonderful thing, and it is absolutely best practices that you have 2 YAB members or 2 youth seats. But just want to encourage you, if not in this motion, in the future, to leave an option to revisit where and how YAB can show up, and to encourage your Board of Governors folks. Hello, I don't know if I've met any of you, but use this as an opportunity to build relationship and connect with the YAB. I think we've seen sometimes it's just having one older adult partner that they can kind of like quietly go, hey, psst, I don't know what that thing means, like that kind of just support like that can help. And so if any of you are open to that as you navigate moving forward with this, should you pass this motion, I would just encourage you to work to build those relationships. So yeah, thank you so much.
Thank you for your comments. Do we have anybody else that would like to make a comment or question?
I'm seeing none.
Very good. Okay, is there any other questions from or comments from the board? Erin?
I would make a motion.
Then we are ready to move forward with the motion.
I would motion to approve 2 Youth Action Board designated seats on the Board of Governance for youth to attend and vote on YHDP and youth-related items, and at the time of annual review of the program, explore full-time membership for both seats.
Is there a second to this motion?
Second.
We have a first and a second. Is there any other questions, comments? If there be none, all those in favor say aye.
Aye.
Any noes? Any abstentions? There being none, it passes unanimously. The next item on the agenda is 4.3. I guess we skip, yes, we're skipping 4.2. Skipping 4.2? Okay.
No, not 4.2.
4.5. Okay, so there's no 4.2 in my thing, but okay, we'll move to 4.2, tribal and COC engagement. We'll turn it over to Greg. Greg.
Yes, good morning, board. We were approached, first of all, we've tried to develop relationships with our tribes. As many of you may know, is that we actually have 12 tribes in Riverside County, the largest in the state as far as the number per county. And we've worked closely with certain tribes such as Saboba, Torres Martinez in the eastern part of the county. But we were approached by the Housing Community Development, or HCD, with the opportunity for technical assistance to engage our continuum of care staff with tribal governments within the region. There's been a couple other counties that have been engaged in this, but HUD, or not HUD, HCD felt again with such a large amount of tribes in the area and some that are not as advantaged as others within the region, this would be beneficial. So we held 3 different sessions. The first 2 sessions were with COC staff, and I want to thank the COC staff. All of them participated. And was basically an education, kind of a tribal 101 in the beginning. But we also had Vice Chairman Malera's from Torres Martinez joined us as well to talk about local tribal issues and some of the challenges and opportunities that exist. The second session was a little more in depth on both the tribal nations overall in the state of California as well as local. And then the third one was actually engagement with the COC staff and tribal representatives. So we had 4 different tribes. We wish we had more, but we had 4 different tribes that participated in that meeting, as well as a woman who actually is a consultant for 9 of our 12 tribes within the region. So it was really good to have her on as a way to continue that relationship. We still have the technical assistance going through the end of June. And so we're working amongst staff to see what other steps we can possibly take. But we want to make it clear that this is not just a one-time engagement, that we really see the opportunity to continue the engagement with tribes. The 4 that we're on, we're extremely excited about the opportunity. We believe they will be joining the COC, which is a really good sign. As many of you know, there is homeless issues within the tribal community. A lot of substance use issues, behavioral health issues as well. Additionally, there's actually opportunity too because of the land mass that they have for actually housing opportunities, not only for tribal members, but for many of the individuals that work in the gaming industry and hospitality industry that they have. So we're really excited about this opportunity. A really shout out to HCD for recognizing Riverside County as a leader in our homeless and housing services and just going the next step for this type of engagement. Happy to answer any questions.
Thank you, Greg. Questions, comments from board members? Very good, starting with Karen.
I'm like super excited about this. I had no idea there were 12 tribes in our county. And Greg, you mentioned, I had a couple questions. You mentioned that there's a consultant, and that consultant is funded by HCD, is that right?
Yes.
Has the consultant, because you have a good handle on the needs. I was going to ask about needs assessment. Have they already conducted that work to kind of drill down, or is that going to be happening, or?
So it's a delicate balance with tribes. Data sharing is difficult, and that's because of historical prejudices and discrimination. And so that's part of this movement is when you're working with tribes, and I was the tribal representative in Congressman Ruiz's office as well, is you have to build a relationship with tribes first before you ask for stuff. And so that's what this process is. So as we develop that, hopefully we'll be able to get that data. What we would really like, and I know Tanya and I have had the conversations in the past, have tried to engage tribes in the point in time count. So as we develop this relationship is get them more involved in that. Ideally, as we know, recording our data within HMIS is far better than the point in time count. So getting them on board with that as well. And we did see some interest from the members that were on the call.
So my second question is, and it's good to know you come with that and many other backgrounds, Greg. Just because the state HCD is leaning in and asking us to help, which I think is great. My question to you is, do you see any opportunities at the federal level for targeted funding for this population that we are not tapping into?
So there already is significant amounts of investment from the federal government within the last 2 to 3 years that have been directly targeted towards tribal governments. that is part of this idea and goal, is to prepare our tribes to go after that. We already disseminate the information that we get from HUD to tribes. I do that on a regular basis, but there's challenges because especially the smaller tribes or those that don't have large gaming operations don't have the admin to actually go after those grants. So we do see the opportunity to advance that partnership, and we'll offer any type of technical assistance that we can possibly do. The consultant that we were working with on this project is also working with the YDHP aspect as well. So.
Well, if we all reflect on the 40 million infusion of HIP funds and the amazing work that HWS did as the administrative agency between IEHP and Molina, and if not that we're like asking you to take on some big huge thing, but boy, if there was an opportunity to do something like that, it'd be super cool because it's just integrating it all into the whole system. Is that unreasonable to even dream about?
No, not at all. Okay. Yeah, not at all.
Thank you for asking. Don't ask, you don't know. Okay, any other questions, comments from board members? Okay, do we have, this is an informational item, but do we have any questions from the public or any comments that request to speak?
No, none.
Okay, very good. And just one quick comment on, I'm glad that Torres Martinez, Chairman Mireles is involved because there's a great need there. Okay, so thank you. Okay, so we'll move on to the next item, being 4.3, Riverside County Adult Services. I'll turn it over to Erin. This is an informational item. Erin?
Good morning, everyone. Can you hear me okay?
Yes.
Okay, great. Thanks for inviting us and putting us on the agenda. My name is Erin Walbeck, and I'm a Deputy Director with Department of Public Social Services Adult Services Division. And then I have one of my managers, Grace, here as well, Grace Beluccio, who oversees one of our specialized APS units, which is Adult Protective Services, the CRIS team, which stands for Crisis Response and Intervention Services. And we were requested to speak today just to share a little bit about the work we do in APS with homeless clients and our collaborations with HWS and COC, which have really been instrumental to our success and ability to serve this population. So really quickly, just a high-level overview of Adult Protective Services. So we intervene in cases of abuse and neglect for elders and dependent adults. And elders for us are those aged 60 and over. And then dependent adults are those aged 18 to 59 who cannot provide for their own care and protection. So those are really the clients that we serve. And on this slide, it gives you a little bit of a sense of our volume. So last fiscal year, and sorry, it's a little bit blurry on this slide, but last fiscal year, we had about 2,500 referrals to APS for homeless or unstably housed clients, because we also do prevention as well. Most of those were for elderly clients, about 77%. And also most of them were for literally homeless clients at 61% of those referrals. And before we go to the next slide, I just wanted to give you an idea of kind of right now, CRIS, which is our homeless unit, currently has about 500 active cases open. So at any given time, we're serving somewhere around 500 clients. And right now, of those 500, 380 of them are off the street, right? So they're temporary, in some sort of temporary or permanent shelter. So at any given time, again, we're looking at somewhere between 300 and 400 folks that we have in some sort of shelter while we're working with them to find more permanent, stable housing. You can go to the next slide. And so I know this is hard to see. We can send it out if needed. But I'm going to turn this over to Grace, because this slide just kind of goes through the process flow for what happens when we get a referral for a homeless APS client and how we serve them.
Good morning, everybody. As Erin said, I'm Grace Blucio. I am the regional manager for the Crisis Response Intervention Services Unit, which is a specialized unit for our homeless seniors and dependent adults. So all of our referrals, they have to come through the hotline because that is the way the legislation is written. We do not have jurisdiction over anyone that has not come through a referral of the hotline. So that's the first step. If there is a senior or dependent adult that is in business homeless or in any type of abuse, neglect, or exploitation situation, all of the referrals must come through the hotline. So once the hotline receives a call, a social worker will go out either immediately or a 24-hour, 2 to 5 day, or a 10-day. It depends on the vulnerability, the situation, if there is an immediate need. And the hotline uses a structured decision-making tool that brings out what is the response time. Once the worker goes out there, the worker will complete an assessment of the client to see what are the barriers, the needs, and the form of abuse. The first thing for Chris, and I'm going to speak specifically for the crisis response unit for our homeless seniors and dependent adults. The first thing we do is find out information about the client to see what it is that brought them to the homelessness, right? We try to first look for diversion to see if there's family members, friends, some type of situation that they can use to allow them to get off the streets immediately. And if that is available, we do everything we can to make those connections. We also have had people that have relatives or family that are out of state and have assisted them with getting to their person that can assist them with housing. If they are not able to have any kind of diversion, then we look at temporary shelter and make sure that they're safe. Temporary shelter can be various things. So we can use a motel for medically needy. We try room and boards. And sometimes if they have a higher level of care, it will either be a hospital, a skilled nursing facility, or possibly an assisted living or a boarding care. Through that, we start working our service plan and we follow through. We try to find them permanent housing as quickly as possible. And once they are housed, then we follow up with case management. So the case isn't automatically closed when they're housed. We usually do an independent living services that can last up to 3 months because we want to make sure that they are set to make sure that they are, I'm sorry, I just saw Rashana's comment. Just to make sure that they're paying their rent, and we don't want them to return to homelessness. So we try to give that extra support and push and advocacy so that they remain in permanent housing. Doing this has allowed us to have a very low recidivism rate and to be able to keep people in their homes. And that's for, can go to the next slide.
Actually, if you could stay on the slide for 1 second, one thing I wanted to mention is another big part of what Grace and her team do, particularly for our population, is working to get the housing choice vouchers, right? So that was a key part of our success to be able to house our senior clients, because with that specific population, poverty and lack of affordable housing tends to be the primary issue that's leading them to homelessness. They're on a fixed, limited income that is likely to not increase, right? It's going to kind of be what it is. And so that really has, our partnership with the Housing Authority and HWS really has been a huge factor in our success and ability to get people in long-term, sustainable, affordable housing. So I just wanted to highlight that as well. Okay, I think we can go to the next slide.
So this is our collaborative services and the MOUs. As Erin just discussed, the biggest game changer for Chris as a whole was the partnership with HWS and the Housing Authority that prioritized our seniors for the Section 8 vouchers. We have been able to really concentrate on our seniors that were at first 65 and older, and then they lessened the age to 62 and over. With the static income of seniors, it's very difficult for them to have supplemental income, or if someone is on SSI or something that prohibits them from making a lot more money, for them to be able to keep the stable housing. So that was a really big game changer. We also partner with our MCOs, our managed care organizations, our health plans, IHP, Molina, at times Kaiser or other smaller different managed care do assist. They have some CALI money that does provide for some housing navigation, some support with paying rent, and some assistance with temporary housing if there is a medical need. Behavioral health has also been a huge partner with us due to the fact that we have utilized a lot of permanent supportive housing, which to me is a really great thing for our seniors that do suffer from some mental health issues that go untreated. And a lot of times that's why they did become homeless. So with behavioral health and the permanent supportive housing and have case management in-house and someone watching over really makes a huge difference to our seniors and their quality of life. And we also have contracts with boarding cares and assisted living facilities that we have a small amount of money set aside that if someone does need a higher level of care, we can assist them with getting directly into an assisted living where they can receive the higher level of care. We also advocate for people that need an assisted living waiver. So if they don't have the income to meet any of the assisted living facilities, the price ranges, there is a Medi-Cal subsidy that we assist with applying for them. And we also assist with advocating and doing the process a little bit quicker while we temporarily house them to keep them safe and off the streets.
And I think you can go to the next slide. So this is, I think, one of our most exciting slides. Oh, it doesn't look very exciting, but the information is exciting. So this is just highlighting through our partnership with HWS and COC and the Board of Governance, who, has to approve of us receiving this money, wanted to share with you all kind of what we've done with some of the funds that we've received. So with our ESG CB2 funds, we were able to permanently house 268 seniors. With cash, we permanently housed 45, and we're still spending a little bit, I think, of our cash money. HAP, we've permanently housed 189 seniors and still spending down those funds. And then most recently started working with all of our partners on the encampment resolution funding for the Santa Cena River Bottom. And I know the team was out there yesterday, and I think we've temporarily housed, so gotten out of the river bottom and into some sort of temporary shelter, at least 2 people, I think 2 seniors, I think I saw in an update yesterday. So we're working on those. And this is not exhaustive of all of the folks that Grace and her team have served. It's really just looking at these particular funding sources. But if you add this up, this is really since 2021, and it's over 500, seniors that we've been able to put in long-term, sustainable, affordable housing. So kudos to Grace and her team, and we appreciate the partnerships with all of you and the agencies that help us to do the work and the needed funds to be able to provide these services to our seniors. So wanted to share that with you all. And then Grace will talk a little bit. Last thing we wanted to share is just a little bit about our multidisciplinary team on the next slide. Grace, did you want to talk about this? You're on mute. Grace, you're on mute. Oh, there you go.
Sorry about that. Okay. So we have an MDT meeting. We have it on a monthly basis. It's usually the third Thursday of every month. We have over 400 community members that are enrolled in the MDT, and it works under the Assembly Bill 210. And this allows for any agency to come in and we can share information, PI. There is no HIPAA restrictions on this due to the fact of the Assembly Bill, the 210. So this makes it a great place that anybody from the community or within adult services can come in with a more challenging case or a client that's a little more difficult to serve, and we can discuss it. And usually there's about 70 to 90 attendees each week. And if you do send in a referral for the MDT, they will make sure the facilitator of the MDT that she contacts the community member or the agency that they need the assistance with to attend the meeting, to make sure that they're there. So this has been a great success. I think a lot of us have cases that we don't know where to go to. And with this meeting, it really allows us to plug in to resources that we may not be familiar with, or that are new, or that are changing, and they have different options. So it does really make a huge difference to us. If anybody wants more information, it is on the ASD website on how to contact and how to sign up for your agency or community organization to be a member of it. There's also, after you present, we do send over a synopsis of what was discussed. And we also do follow-up presentations, because it's always great to hear a success story and how the problem was resolved. So it does give people other ideas of how to follow up with their own clients.
And then I see
Erin
someone
just
asked
put
in the
the
chat.
information.
Yeah, for that information. So I'm putting it in there right now. That's where you can find the homeless MDT info. Oh, we got it. So thanks, Grace. Any questions? Well, we appreciate the time and invitation. If no one has any questions or comments. And if folks in the room are talking, I don't think we can hear them, or at least I can't.
No, we can't hear Greg.
Go.
Can you hear us now?
Yes.
Okay, perfect.
Perfect.
Okay.
Thank you. Again, I want to give a big shout out to Adult Services Division.
So can we ask for technical support? I can talk.
Can you guys hear us now?
Yeah, that works.
Yes.
Oh, that's right.
Okay, perfect, great. Sorry about that.
No echo and perfect.
Again, I want to give a big shout out to Adult Services Division. We've really developed an amazing partnership between Housing and Workforce Solutions as well as behavioral health. A lot of this came out of the development of the RIVCO 100 program. Additionally, though, for those who follow me know I've been at too many conferences over the last 4 months, but the rising need of seniors and homelessness and housing is exponential across the country, and we're recognizing that in Riverside County. Many of you are aware that the county is undergoing implementation of integrated service delivery model throughout the county. We have been tapped as cohort 3 for Housing and Workforce Solutions to develop an integrated service delivery method around seniors and housing. That initiative is called HOUSE. We renamed it from SUDS. We don't know why they had it called SUDS. But the acronym actually stands for Housing Our Underserved Seniors Efficiently. We've already had probably 3 planning meetings amongst staff, but we had our first what we call rapid improvement event a couple of weeks ago with about 25 individuals from various agencies within the county, in addition to Path of Life. So we'll be piloting a project within the Path of Life, utilizing our whole person health score in conjunction with the VI SPDAT to do not only the assessment for the community connect, but also additionally the whole person health score to refer out to other services. We're very excited about this. Additionally, this initiative in our department is the first department that will be working with our data, with our CIT, our data team for the integration. As part of integrated service delivery, the data component is a huge part. As we know, many of our agencies and departments use different database systems that don't know how to talk to each other. So we've actually contracted with Amazon through the county to develop kind of a one-stop database system. So we're very excited about the partnership and being the first department to be able to do that. And we see the integration within HMIS, hopefully Epic down the road, for this type of database system. We'll actually bring back a little more detailed presentation at the next Board of Governance meeting on this initiative, but I just wanted to highlight that as it dovetails off the amazing work that Adult Services Division has. I will add 2 things, is that some of the challenges that we're going to experience are the lack of an additional round of HAP funding. I'll get into that a little bit later in announcements, but also additionally vouchers. As we know, vouchers are limited anyway, and that is a severe impediment on making sure that this program and targeting housing of seniors is successful going forward. So.
Thank you, Greg. We'll open it up to questions and comments from our board. I will start with Roman.
So I have a question about how much information does the referring party have to have about the senior that they're referring through APS? Do they have to have all of the information that they can possibly get? Do they have to have the age, the name, the birth date, where they're located, how long they're going to be in that area? I just need to know, like, how much information does the referring party have to know about the senior that they're referring or they're calling on? That's one question. I have a couple of different questions, so you can.
Do you want me to take that, Erin?
Yes, please take it, and then he'll ask a second after you addressed it. Thank you.
Yeah, go ahead, Bruce.
So with the hotline, you need to have a name unless you can give a really good description. The other part of the age, they do like estimated ages, just for the fact that an elder is 60 or over in the state of California, and the dependent adult is 18 to 59. So that's those requirements. We don't have to have an actual address, but you can say like the corner of Maple and Maine, right? But you would have to give a pretty good descriptor so we're able to identify the person. That's for that. Or if you have their cell phone number or a phone number where we can contact them, we take that also. We do make at least 3 attempts, if not more, to locate the person. We don't just go out there and say, hey, we can't find them, we're done. We try to do that again. And we also contact the reporting party to make sure that the information is still accurate prior to us going out. So we do multiple in our due diligence to find the client. As far as knowing a lot of information, anybody can call for a client. So not necessarily a person on the street that's calling into the hotline would know a date of birth or a social security or a diagnosis. They can call in, and if it does meet the criteria per the legislation, then we will go out and respond.
Thank you. Next question, Roman?
Thanks. Okay, so you already asked how long. So when you say that you make multiple attempts, it's multiple attempts within that same week, month, 6 months?
So we first make our own attempt. It depends if it came in as an immediate 24, 2 to 5, or a 10-day response. We make our first attempt within those timelines. After that, we might go out the following day. And it all depends. It's really a situational type of condition, right? So if it's someone that has their name, age, date of birth, we look into various other programs also. So we do have the ability to look, if we have a date of birth, a name, we can look into IHSS to see if they have another address or a means to locate. We can look at if they're receiving CalFresh or Medi-Cal to see if we call up the information that we have, if we have a health plan through one of the different sources of information. Do we keep it open for more than 30 days? Not usually, unless we have something that they went out of town and they came back in. But the cases can always be called back in. There's not a definitive timeline that we say, keep it open 30 days. We just try multiple attempts on different times of day and on different days. So we may make 2 attempts the first week, and then the second week we make another attempt. And the attempts can be phone calls, collateral contacts, and actual locations.
Sweet. One more question. And so I'm assuming that the senior has to agree to any services that you're going to provide, correct?
I'm sorry, could you repeat that?
Senior has to agree to any of the services that you're going to provide, correct?
So they have the right to, so all seniors, because they're adults, have the right to self-determination. The only way that we would continue if they told us would be if they lack capacity or they have some type of disability that impairs their ability to make decisions.
And that determination is made right there on site, or?
No, well, then we would bring it over because we work with different nurses, physicians, hospitals. We contact health plans, primary cares to see if they have additional information. So if I went to somebody, we do a capacity. We can do a MOCA, which is a test that is administered to determine their level of cognitive comprehension. Or we could do a mini mental. There's a lot of different tools that they assess. We also assess for depression, suicide risk when we are out there, if the client allows us to ask the additional questions. So in that first face-to-face meeting, there is a full assessment done of any barriers, risks, history. And we also look at the history of the client if they are previous clients. So we look at prior cases to see how we can do this better if there was a prior case, and to see how we can continue to assist the client.
One more question real quick. The last question. Does the senior have a choice as far as where they would go? Do they have to?
Absolutely. They run the show. This is their plan. So when we complete our service plan, it is completely client involved. So if the client states that they want to live, say, in Corona, that's where they're from, that's where their support network is, that is the area we concentrate on. Does it always work out that we can find housing in Corona? No. But we can do a diligent search and try to assist and advocate for that client to be in the area that they want to be in, or that they have either familial or supportive people and family or friends that are there. Most of our seniors have a network of physicians that they're already working with. So if the senior is from India, and that's where all their doctors are, that's where their support system is, we're not going to relocate them to Riverside. We're going to keep them in the area that they have that support. That is very important to seniors, especially, well, it's important to me too. I don't want to leave my doctor, right? Everybody wants to stay where they're comfortable, where they know what the bus routes are, where they know where a food bank is, where they know where any type of support is for them. So we really try to keep them in the area that they have the most support.
Thank you. I appreciate it.
Thank you, Roman. Any other questions from our board members? Yes, Karen?
So first of all, I just wanted to thank you two ladies for the phenomenal presentation, and especially a shout out to Grace and the amazing work that you do with your team. I've had personal experience where we've had shared clients, and the mutually beneficial relationship has been amazing. And I, you know, as a governing board that helps to support funding decisions, I can personally attest to how critical it is for us to continue to allocate resources, because we do have an age tsunami that is upon us and so many vulnerable seniors that are out there. And so to that end, I had a question, and I don't know if, did I understand correctly that at any one time you have anywhere from 300 to 400 seniors in shelter, or was that cumulative to date?
So that's
No, that's currently.
At any one time. And in shelter, I'm using kind of in some off the street, right? So there could be in a motel, a room and board, an emergency shelter, but there's somewhere other than on the street or in permanent housing.
And I know you all have limited resources. So with the funding resources that you receive, if you were to take a look at that 400 that are currently in shelter, about how many of those, just a rough percentage, are you personally funding through the contracts that you've received for this population versus the overall continuum of care system? Is it 30, 40, 50? Do you know the percentage?
I want to make sure I'm understanding your question when you said, so I don't know the percentage of currently open cases that are like attributed to those different funding sources. Is that what you're asking?
Well, I just know in working with Grace, we've shared some clients where we transitioned, let's say, from our motel program to a program because they have funding, let's say, through HWS. And so we were able to help a senior who needed extended time in a motel. So you guys have certain buckets of money through the county agencies that you're funded versus just going to the Path of Life or just going to some other shelter. That's my question.
Right.
Just to be able to demonstrate.
Yeah, Grace, do you know the answer to that? Or is that something that we might need to follow up on?
I think that's something we need to follow up on. And hi, Karen, thank you so much for the kind words. I really appreciate that. And you're a great partner also. So I just want to preface this, that our money isn't infinite, right? We have limited amounts of money in each pot. And Erin has been great about really using the money expertly, right, with braided funding. So it's not only just one specific funding that we use for a client. That client can be receiving 3 different kinds of funding at times, right? Depending upon what the restrictions are for that funding. So we have some fundings are much more flexible than other fundings. So that's how we look at it. We don't, and I just kind of want to just make some clarifications. So a lot of times people think we have a motel voucher program. ASD does not have a motel voucher program. I think some other departments in DPSS do, but we do not. What we do is we evaluate each client and put them where it's appropriate with the appropriate funding. So it all depends on the assessment of it. And I think that's important to remember. And we try our best to serve as many people as we can. with the correct type of funding and the correct type of resources. So I don't think it would be even possible to say this breakdown of each funding goes to each client, because a lot of times it's intermingled with it.
I think oh, sorry. I was just gonna say, I think the question is, how many of those clients, regardless of what funding source it is coming out of like ASD's resources versus we can be case managing a client that's on like behavioral health motel voucher program, for example, right? So they might be in a motel that behavioral health, is paying for, but we're case managing that. And is that like the differentiation you're looking for, Karen?
Yeah, just my point was to make sure that everybody understands what a phenomenal job you guys are doing with a very vulnerable population. We have an age tsunami upon us, and there's been benefit because there's been allocation of continuum of care resources to support what you all are doing. That's what I was trying to get at. And then the other thing too, and this is probably more to Tanya and Greg. Greg, you mentioned challenges with vouchers. We know this is absolutely critical for this population because they need ongoing affordable housing. Are we able to continue to receive these referrals is the first question for the Section 8 voucher. And the second is it time for us to think about, I don't know if it's collaborating with CSAC, doing our own legislative, but pushing hard. We need more regular housing choice vouchers, and it's time to stand up to advocate for that.
So we're reaching a limit on the ability to actually distribute vouchers for these type of programming. There's constant advocacy going on for more vouchers, whether it's through the National Alliance to End Homelessness, local advocacy groups, CSAC, League of Cities. It's across the country. This is a federal issue, and I constantly now say that the states, the cities, the counties have all stepped up, and that it's time for the federal government to step up to the plate as well. Nothing's going to happen within at least the next 9 months, and you're probably talking at least 1 to 2 years before anything else would happen. We're looking at some other options of possibly other pots of money to subsidize some vouchers, but we can't do any guarantees on that. Whether that's through some remaining ARPA, again, and these are just thoughts. These are not commitments, so not to get ourselves in trouble. But we realize the need is there, and so I think this board knows our department and the county have been extremely nimble and flexible on how we get other pots of money. There's potential around CalAIM, even though the rental supports are relatively short term and are targeted primarily to behavioral health clients, but looking at getting further waivers through the federal government, which could happen sooner than say HUD legislation or more vouchers. So we're constantly looking at other options, but it is a real issue. And it's something, again, that the federal government needs to be held to the fire on.
So just, I guess, for us to be supportive, because this is such a vulnerable population, is there anything else besides supporting funding recommendations that we can do for?
Not really,
okay.
Because of the funding is so prescribed by the federal government. So.
Well, good job. It's amazing. And I'm just so proud of the amazing collaboration and partnership.
Thank you, Karen. Any other questions, comments from board members? Okay, I do have a comment. Thank you for the presentation. That was very well done. When you talk about the fact that we don't have endless amount of funding to help, that we have a certain amount, and we have such a big county and so spread out, and when the number of people that you are helping and the funding that's allocated, I'm just wondering, is that, is each region allocated a certain amount? Is it based on need, numbers, the hard to reach areas that are in the corners of the county? Are they getting the resources, or are they, because it's harder to house people in further out areas because the housing limitations are there, the higher rents. So I'm just wondering, when you think about regionally, what are the challenges that you have And how are you dealing with those challenges?
Are you directing that to, with the ASD, I serve, my unit serves the whole entire county. We go from, Riverside to Temecula to Blythe. So you're absolutely right that there are different cities that it's more difficult than other cities to find affordable housing. What we try to do is really look for alternative housing. Also, we have some situations that there's a room for rent or something to that effect that makes it more affordable for our clients to be able to move in. What we do have is we have 2 community program specialists that their whole objective is to find new landlords, do landlord engagement. So that is disappointing that on July 1st that we can no longer do the double deposits, as was stated earlier, because that is a huge incentive for our landlords. But we do offer them that once that the people are housed, that we do stay on to make sure that the rent is being paid for a few months. But we are always, looking for new housing opportunities on each different city. And we do engage with local organizations. With the desert, we do interact with Martha's Kitchen, CVRM, CVAG. With the Temecula, the Southwest area, we do interact with SWAG and the different shelters and different agencies there. It all depends on the city. We definitely try to integrate ourselves with the local resources, churches, NGOs, whatever it is that may be, to assist. It is challenging at times because some people do want to live in an area that it is almost impossible. But I think with these new projects with HomeKey coming up, there's a new PSH or PBV that's coming up in the Temecula area, which I'm going to put in a plug. ASD would love to take as many of those apartments as possible. So I think it's just really getting out there in the community and searching for our additional resources to serve our clients.
If I could just add, oh, I'm sorry, go ahead.
Maybe you were going to say the same thing, Erin, but just in terms of like service area and how services are determined, it's much like children's services in that it's based on need. So it's the referrals that are coming in are going to determine where APS is sending their caseworkers to respond to the referrals. So it isn't like there's a pre-allocated, this area gets this amount, this area gets that amount. It's generated by the request or the referrals or the reports that are coming in.
Yes,
Is that what you're going to say,
that is
Erin?
what I was going to say, yeah.
Thank you. Ben, you had a question or comment?
Yes. Hi, Erin. Hi, Grace. This is Ben. Thank you for the wonderful presentation, your remarkable collaboration with many agencies. The question is, I'm wondering if there's data that you collect that
Hold on. Can the person that has, there's some background, if you're not speaking, can you put yourself on mute, please? Thank you. Ben, go ahead.
My question is, I'm wondering if you collect data that maybe we don't come in contact with since you are investigating.
Uh-oh, did Ben cut out or was it just me?
I think Ben is cut out.
Ben they need to take the mic is muted under John Garside.
Testing, 1, 2, 3. Can you hear me?
I think you're back.
I'm back. Great. Thank you. My question is, I'm wondering if Adult Protective Services collects data and does that data make it to HWS? I want to make sure that we're capturing all older adults that are experiencing homelessness or at risk of. Do we share data? Do we collaborate on data? I'm assuming that APS may have some additional numbers that we may not. So just curious about that.
Yeah, it's a good question. So when APS because all of our clients are APS, we are operating under certain confidentiality rules around data and information sharing. But for anyone served through COC HWS funding, right, we enroll those folks in HMIS. So all of those clients are enrolled in HMIS, so that level of information is available. And then, Greg mentioned the integrated service delivery efforts, and there is, one effort particularly around data sharing, and it is data sharing for homeless seniors. And I'm not the lead from our agency on that initiative, but that is something that we're involved in, and that does involve, all of the partner agencies as well.
Thank you.
Mm-hmm.
Thank you for that information. Do we have any questions or comments from the public? There being none, this was an informational item and it was very informational. So thank you very much for that presentation. We will move on to the next item, which is 4.4, Riverside County Shelter Capacity for Harsh Weather Seasons. Tanya.
All right. So this item was strongly encouraged by Erin Edwards. She encouraged us to have a conversation around our shelter bed capacity and specifically around intermittent shelters, how they are activated to enhance bed capacity during extreme weather conditions, natural disasters, and other emergencies. I think we all know this conversation is critical because you can't be engaged in this work and not recognize the great vulnerabilities that people have, especially when they're out in the ailments, and how one's conditions, whether it's health conditions, physical, emotional health, behavioral health, worsen when they are out on the streets without a home. And we certainly lived through many emergencies such as COVID. Hurricane Hilary is one that hit us recently, in addition to many fires, floods in the Santa Ana riverbed, as well as in the Coachella Valley. So with this, it's really important for us to recognize that the main issue, as was stated by our Adult Services Division, is a housing issue. You can ask any shelter director who is here today, Angelina Coe. I saw Chris Oberg was in attendance virtually, that they are generally always full at capacity. Karen Roper, I'm sure you can attest to that being the same for the City of Corona's Hope Harrison Center and the hotel voucher program that you guys offer. And I'm sure the same is for the programs that are operated through the City of Riverside. So that's why this conversation is really, really important. And if we advance to the next slide, I have to apologize to the board because I added this a couple slides this morning. So they're not in your printout, but they are on screen, and I hope that you're able to view them. But on this slide, you will see a list of permanent fixed shelter sites that exist throughout the county. These are, again, across all 5 supervisorial districts and encompass over 900 permanent beds. I need to note that this does not include the use of hotel vouchers, which have been a common practice both by counties and cities, in addition to nonprofit, faith-based, and private organizations who use that as a way to grant immediate and temporary stays, especially when our shelter is at full, which, as I mentioned, is irregular. If we advance to the next slide, you'll see that we included a breakdown of overflow or temporary resources that have been made available when, again, those different types of emergencies exist. And on this table, you'll see that we broke it down by existing sites, noting that, we have really great examples of shelters on both sides of the county. In the City of Corona, the Hope Harrison Center, which has developed policies and deliverables in their contracts to expand bed capacity whenever the need arises, using, as what we've heard, our COC chair and board member use time and time again, a whatever it takes approach. Really proud to say that the Coachella Valley Rescue Mission also utilizes a similar model and has the ability to increase up to 100 beds using a gymnasium that they have there. On the second row, column, here I am. You'll see that we included a breakdown of cooling and warm shelters that are activated during very cold or extreme heat seasons. And we're very fortunate, again, to have these sites located in the east and the west. Going back to the first column, the existing shelters, those additional bed expansions that are being made through the City of Corona and the Coachella Valley Rescue Mission, I have to stress, are utilizing resources that they have in-house. So funds that, operating funds that they have either allocated through the city or Coachella Valley Rescue Mission has raised through different fundraising efforts. For the second category with our cooling and warm shelters, those programs have really included partnerships with cities and the County of Riverside, matching dollars to activate those programs as needed. The last category really emphasizes shelters that have been activated during disaster response. And I will say that it is Emma's dream as she's really engaged, and the person on our end working with the Emergency Management Department to ensure that we have designated sites across our entire county to support unsheltered residents so that as we prepare for the unknown, that they can also prepare for whatever's to come. And so to that end, we've activated partnerships with Path of Life, Galilee Center, Salvation Army, Coachella Valley Rescue Mission to also activate beds. The difference here in regards to funding is I'm proud to say that these organizations oftentimes upfront the costs initially, and then they work with our county department through Emma and our emergency management department to bill those costs back to FEMA. So oftentimes these agencies are waiting several weeks, several months before they receive reimbursement. So to that end, we are very much interested in looking at how we scale up these opportunities across the county. I think I'm going to say Councilwoman Edwards, her heart was really, how do we determine when these need to be activated? And again, it really depends on each community and each specific circumstance. Funding, of course, plays a key issue. And I think what I would really want to highlight is the programs that have been successful have included partnerships, not only between the provider, the county, but also the cities that they are located in. And lastly, what I will say is, or two things. One is that our Community Action Partnership Division does also activate over 45 different sites throughout the county that operate as day centers between the hours of 8 and 5 p.m. During the summer and winter months. And so these are also great resources, and I know that our outreach workers are taking clients to these centers where they have access to whether it's a warm or a cool center, but like food and other information on resources that can help them stabilize. And then lastly, what I will say on our end to fulfill Emma's dream is we're looking at continuing to revamp our existing subrecipient agreements so that there's a clear deliverable that states our agencies will participate and work with us to activate these resources. To that end, we haven't had that right in our contracts up until recently, and time again, all of these agencies on screen have stepped up out of the kindness of their heart, but we recognize the value in having formal processes written so that if any of us go away, these processes, these resources continue. Thank you.
Thank you, Tanya. I'm gonna open it up to questions and comments from our board, starting with Karen.
So Tanya, thank you so much, and thank you for the suggestion. This is such a really important topic, and To the cities that are listening out there, I just want to encourage you all to follow in the footsteps of Corona and Riverside and other cities that have a direct hand in doing what they can to expand shelter. The county cannot do it all. We really need to step up as cities. I want to, Tanya, I'm super excited. We need to update that slide because both Corona and Norco have year-round motel shelter, and they are also activated. And if we're thinking about creative ways to build capacity for those that are listening, there's two different distinctions. So like for a congregate shelter, you have staff there that are 24/7. For us, at any one time, we worked with our fire department. We can set up in the dining hall and have overflow of 16 additional beds. So that's 56 beds total. And it's for anything. It could be for hot or cold. It could be for a disaster. It could be for whatever emergency. It is there for overflow. And so that is, you have staff there 24/7. For a motel model, when you're building provisions like that in a contract, you have to think about paying for a cushion for extra staff to be activated overtime so that when those disasters happen, they automatically are paid and are on call to be able to facilitate the transportation and placement in motel and food and all that kind of stuff. But it's super easy to add those kinds of provisions in contracts so that at any time, whatever the need may be, we can expand capacity and be a resource to get folks out of the elements. So I'm just super excited to see this being standardized and that we can do it across the region and share the love with being able to help more people in critical times. So thank you to the team.
Thank you, Karen. And next, Erin.
Thank you so much for the presentation. I'm just curious, when you look at the numbers, it's great to see here how many beds that we have. How many beds do we need on the coldest night? I hear you say that we are at capacity. Do we have to turn people away? And what does that indicate is the number that is our goal?
Yeah, so there's different data points that we can use to help us determine need. While you have heard me time and time again say that the point in time count is not a good reflection of what the need is in Riverside County, because we're running programs year long, and when we actually look at the number of people that access our system, right, that number is 5 times higher. But I think where the point in time count is helpful is looking at, right, the number of people that are experiencing homelessness on a single point in time. And so, right, what our PIT count numbers from 2023 tell us is that we had over 2,400 people that were homeless on the street on any given time. So that, I think, is a good indicator of how many beds, you know, we would need. I think the other thing that my team would hate me for saying, because they're such strong advocates for permanent housing, as many of you are, is that, and Chris Olberg has told me time and time again, so Chris, I'm thinking of you, Director at Path of Life, with this in mind, is that, you know, shelters could shorten the length of stays that people remain if they had an output into housing. So that could also, right, these 900 beds would work and be sufficient if we had greater output and we could quickly connect people to housing. So I think those are kind of two different points that we need to consider. And Angelina, looks like you have a comment.
Okay, so for Erin is still talking, so I'm gonna let her continue.
Sorry, it's my last meeting, so I have a lot to say. So on this, I think you're absolutely right. What I've heard is that when we compare with vouchers to get people, to move people, that's helpful. And so what is our plan to be able to do more of that in future years?
We are going to miss you, and I hope we find a way to stay connected with you. I think what we have done locally with our HAP allocations, that's the state funding that we've received through the Housing Homeless Assistance Program, is that in our requests for proposals and in our processes, we have basically informed providers that they are to prioritize individuals who are coming from shelters, so that, right, we have the ability to kind of move people quickly through that continuum. And in addition, I know in speaking with Amy Primrose that same prioritization is also looking at being implemented with our youth homelessness demonstration program.
And I'll add too, is that on the end product of more housing is that the county has significantly invested in production of housing, utilizing ARPA dollars, CARES Act dollars, HIP dollars. So that's for that end product, for that throughput. So, you know, we've got over 1,800 units, I believe, in over 2,000 now. Yeah, goes up every day in production. So again, to Tanya's point, looking at the whole continuum of service.
Of course, but then if we are anticipating that HAP funding is going away, then that would inhibit our ability to provide the vouchers that are needed to create that continuum.
So, but to that point, Councilmember, is that looking at other options, though, exploring CalAIM, other partnerships with the health plans, looking at private and philanthropic donations, which we don't do enough of throughout the state, but primarily, especially in Riverside County. So we're constantly talking about different resources and how we supplement that, and continuing advocacy, which I'll talk about later on HAP.
I'm so glad that you brought up the private and philanthropic resources, Greg. I think we have a great opportunity there, as you pointed out. And Tanya, back to your point about the number of beds we need, I certainly appreciate looking to the point in time count to understand how many beds are needed a night. My question is maybe speaking more specifically to, do we have a number of how many people we're turning away from the shelters because they're full in the hottest and the coldest times, which gives us a sense of both need and desire?
Yeah, I would have to work with our shelters and check in with our HMIS team to see how and if, yeah, and our coordinated entry system to see how that information is captured. And so I'm happy to, I think the providers will know. What I will say with HMIS is that normally only individuals that are getting access to a bed are being tracked. But I think, right, with your comment, it creates or an idea of could we track people that are being referred and are turned away. So I know our HMIS team is listening. Let's consider that because I think that's really good information, to your point, to really help us on any given time speak to the need, because PIC count is done in January. What we know with homelessness is there are trends, right, that happen over the year due to the summer, winter months, those things that I want to make sure get captured.
Well, to me, it would give us a sense of what a good goal could be, because of course, if I'm remembering correctly, we have 618 unsheltered people on the street in Riverside every night, according to the point in time count. So we would want to be able to have all of those beds. That's a lot of beds to be able to need to provide. While that's the ultimate goal, what could our short-term goal be? And so if we had a number of who's coming and saying, I'm ready for a bed right now, but there isn't one, then we know, okay, we need X number of beds, and here's where we need to target them.
I would add too, a larger question is that there's many people that would take shelter if it wasn't congregate. And so, you know, looking at as we move forward, what types of sheltering are we doing? Because there's a larger need for shelter outside of non-congregate that we're not addressing. And that's not by no fault of our own, it's lack of resources primarily, and NIMBYism.
Thank you, Greg. Thank you, Tanya. Okay, next we have Angelina.
Thank you. I appreciate the time. To answer or to piggyback off what Tanya was saying, even when we're at capacity, and sometimes it's because of the way the rooms are set up, we can't shelter multiple families in the same space. It gets difficult. So if we have 20 beds, but if we have 2 families, then that reduces the number of beds depending on the family size. So it's not just beds, it's also family size and capacity. That's a different thing. And we also have clients that turn down services. We're not turning them down. They're coming to us because of transportation, distance, the type of limitation within the housing that we're able to provide. And of course, where do they go afterwards? What happens next? What is the next stage? How long is the waiting list for housing afterwards, especially when they're dealing with individuals that are victims and are trying to survive in the world, and their option is go into a shelter or stay and endure. The other factor too to look at, and it was brought up, is not just the congregant space, but also the other issues that we are seeing with mixing of populations, with men and females and transgenders and LGBTQ. Sometimes there's an issue with of that, and we also always work with the clients. Shelter is not always the first option. Do you have family you can go to? Do you have other resources that you can stay with a friend for a couple of weeks while we work on this, and this? So there's a lot of factors to look at when you're denying someone or you're turning them away. Did you turn them away because they had other alternative housing, so they are not unsheltered, or are they being turned away because they can't get to the area, or they don't want to be in this specific area? We're only a shelter in the Coachella Valley. We don't have another shelter somewhere else. So if they're in Riverside or Hemet or Paris, they might not want to come all the way to the heart of the Coachella Valley, but they need those services. So I just wanted to add that.
Thank you, Angelina. Before I ask if we have any more questions, I do want to point out that we are approaching 11 o'clock, so we might have to run a little bit over, but I don't want to stop questions that need to be asked, but I don't want to lose our quorum either. So, okay, any other questions?
I do.
Bill.
Tanya, thank you very much for your report. It was incredibly enlightening. I think it would be helpful to encourage our providers to really track that information, because I think that will help us know what is the true need. When folks are being turned away from these facilities, it's absolutely heartbreaking, because they're at dire times, incredibly cold, rain, what have you, extremes in weather. And it would be helpful to know, what is that population? And I think it helps us, seek more funding or be more effective at seeking our funding from grant sources, knowing that data.
Thank you, Bill. Any other questions? Carol.
This is just kind of a wild idea, but I'm going to put it out there. In the city of Banning, we have a plethora of empty buildings just sitting all along the main street. Has anyone ever thought about working with landlords or the city or whatever to utilize these empty buildings? And I'm talking 2 to 3 years these buildings are sitting there, to use them to turn into temporary shelters or permanent housing or whatever, because you've got your infrastructure. I mean, you've got your building. I'm sure there have to be all kinds of modifications and stuff. But I'm just wondering is that an untapped resource?
So the physical building is not the problem. It's the staffing, it's the food, it's the supplies. So, just for example, to stand up a 30-bed, just overnight shelter in Palm Springs, and this has been a couple years ago that we actually paid for, was $30,000 a month. And so it's extremely costly. So the physical location is not the problem. It's the same thing around like permanent supportive housing. There's been a lot of conversation about converting, say, malls or old commercial buildings. It's actually more expensive to convert those than it is to knock them down and build up. So it's the physical location. It really gets down to the operational costs is the impediment.
But is there funding of any kind that the COC has or can be allocated through other resources to set up and staff and provide the infrastructure if the building is found?
The short answer is no, because those funds are already allocated and quite a bit to sheltering services. There's been a move away by agencies, primarily the state, against funding shelter operations and doing more permanent housing or transitional housing. So.
Okay, thank you.
Any other board members have any questions or comments on this item?
One other thing, an encouragement, and it depends upon whether or not they exist in the particular area, is you can implement a motel shelter program in weeks, and you can be very short, so you can flip it on and flip it off quickly, and I just wanted to throw that out there. So.
Thank you, Karen. Thank you, everyone. Angelina?
And I just wanted to add, if we do track that data, and we try to see like why we're denying clients, just so that we can see, is there a prejudice? Is there a bias? Is there something we're missing that's happening in this population that we need to address and adjust our services accordingly? Or can we adjust our services accordingly? And if we're seeing that across all of the providers that now are capturing that data, it might help us tweak what we're doing, because it's not what we think they need, it's what they need. We have to meet them where they are and provide them what they're looking for. The same way it's volunteer participation and they have to consent, the same thing. Why are we providing something that may not fit the need? And a lot of them don't like congregate shelter, but that's what we have. But maybe we need to start looking at a different model too. So.
Thank you, Angelina. Any other members have any questions or comments? Okay, thank you very much for all of your questions and your comments, and thank you, staff, for that information. The next item, 4.5, is going to be continued because there's more information that is coming, and so at the next meeting, we will have that covered. Item 4.6, it has been brought to my attention that this item can be continued till the next meeting as well. I don't want to be rushing through it, and I know that people probably have their schedules, so I think that's a good idea. So we're going to continue item 4.6. It's an informational item, so we don't have to vote on it, right? Okay. Okay, so I'm going to turn it over to my vice chair to take over the meeting.
Thank you, Letty. Now we'll go to announcements from the Board of Governors. Any announcements? Yes.
I just wanted to take a moment to reflect on the amazing success that came out of the reentry conference, our region's first regional reentry conference. I want to give a shout out to Vanya Corliss from Starting Over, who took the initiative to get a grant to pay for all of the costs to bring that together. It was absolutely transformational. I would like to thank Tanya and Emma and the folks at HWS that did a lot of heavy lifting with us through the planning committees, staffing the event. I know our city was excited to be involved and contribute resources to support that event. I really want to give a shout out to Anise, who is a member of the Board of Governance, who spoke and gave her own personal lived experience through being justice involved, and what a great leader she is. And also to Dr. Charles Lee Johnson, who's on our Board of Governance, who I felt like I was in church. That it was like so amazing, his message, and his whole team from Cal Baptist. And all of the speakers, the panels, it was phenomenal. And I think an eye-opener to how much more we need to focus in this region on the justice involved population. And so I just want to give a plug for the leaders on this board to think about, because we really need to move this needle forward, getting involved in our reentry working group, because to me, you need like also folks at this level to be participating from a policy level to keep the energy and the momentum moving forward. So thank you to everybody who was involved in that. And Tanya, am I forgetting anybody, or Emma? Because that was like just such an amazing, I just want to make sure.
Did you mention Criselda?
Criselda, oh my gosh, yes. If you know Criselda, who is now actually working for National Decor, literally did all of the minutes and the follow-up and facilitating the meetings, and just absolutely amazing. We met for weeks and weeks planning for this.
Yes, and also Miss Karen was an integral part of the planning process as well. And our Youth Action Board, we had members that actually facilitated one of the discussions. So we were very, very proud to have them there and representing.
Thank you. Any announcements from the staff?
Yeah, Ben, just a couple updates on some legislation. I talked about the HAP dollars, again, the Housing Homeless Assistance Program. We have had 5 rounds of that. The governor did not propose a round 6, which is very concerning to many of us. There is, though, advocacy efforts underway. I'm part of a statewide coalition called Bring California Home that actually is working in conjunction with numerous providers and housers and advocates, but as well as the CSAC, the California State Association of Counties, as well as the League of Cities, the 13 big mayors are all advocating for a budget ask for an additional $1 billion round 6 on HAP. So again, I encourage you to call your assembly and senators and encourage that. Additionally, some of you may be familiar with SB 1011, which was an attempt to criminalize encampments and homelessness. That failed yesterday in a Senate committee, thank God. With that being said, though, there is a case, as probably many of you are aware, before the Supreme Court that basically would do much the same thing. And so we're watching that. Many of the advocacy groups in the state have filed amicus briefs in regards to that case, so we'll continue to monitor that. The only other big thing is there is Assemblymember Wicks, and I believe it's AB 1127 or 57, I'm going to forget the number, which is a $10 billion housing bond that we weren't sure would make it through, but it looks like it is doing better than what we thought. So that would go to the ballot on November, and we'll keep you updated on that. I just wanted to really emphasize the HAP dollars, though, because this will probably be the last meeting before the May revise of the budget. So again, encouraging those that would support that additional round to contact the legislature.
Emma.
So while we were sitting here, I realized a little while ago that our next meeting is June 20th. And given that we already have such a condensed timeline for the YHDP RFP, and in order to allow additional time, excuse me, for evaluation and for the YAB to be able to have their meeting and approve the recommended awards, we would like to push the Board of Governance meeting by a week to June 27th. And staff already checked with the city. The chambers are available. So I would like to go ahead and propose that we move the next Board of Governance meeting from June 20th to June 27th. So it's just the following Thursday.
Yes, that would be a good idea to accommodate the application. If you can send out the calendar invite. And okay, so you're done. Sorry, I'm Letty. I'm not Ben, so he had to leave, unfortunately. Okay, Angelina.
I want to kind of piggyback off where Greg was going. I know I mentioned a while ago about VOCA and VOCA funding, which is the Victims of Crime Act funds that were being considered to be cut. And it was decided that it's not officially decided, but the cuts are going to happen. And now our funding sources, which is the California Department of Emergency Services, has stated that effective 24-25, there will be an overall 44.7% cut, which is a total funding of $7 million. And they are proposing advocacy for $100 million in additional funding to be added from other sources. But with that 44.7% impact on victims of crime services, that will affect our family justice centers, our rape crisis centers, our human trafficking, domestic violence, child sexual assault centers, and those kind of facilities. So this is a huge impact, and it was only supposed to be a 30% cut, possibly starting in 24-25, and now they're talking about 44.7 and increasing 10% every year thereafter. So there's still time to contact your local officials and fight for that funding not to be cut, or for at least more monies to put it back in under additional funding, and to support AB 2432, which is another assembly bill for public safety that would bring additional funds under a different source, not under VOCA, for these funds that are affecting and impacting survivors and victims of crime in general. So I wanted to bring that to everyone's attention, because that will truly impact our ability to provide the services that we are providing. We are committed that we will use whatever resources we have to continue the bed capacity, but I'm going to tell you right now that is going to drastically affect, not necessarily next year, but the year thereafter, our our staffing capacity, and our ability to reach as many clients as we do currently. And that is a big blow, because we really didn't think they were going to go up in the percentage. We really thought they'd go down. So I wanted to bring that up, but we are committed to being here. We're looking to fight the good fight. I'm committed to stay and do what I can to continue to advocate for additional funding and resources. And we need to continue to seek and diversify and work together to help those that don't have a voice and are being victimized in our communities, that don't have anywhere to go, and now they're cutting more services that will really lessen their ability to get that help immediately. So
Thank you, Angelina. Any other questions? Carol?
Yes, as a representative of the small nonprofits in the area, I want to encourage all of us to do what I call the big boys do, which is to account for the services that you do and to actually produce outcomes of the services.
Was $40. I remember.
The persons that are joining virtually, can you, Mariel, can you silence them? Thank you. Go ahead,
So
Sarah.
anyway, I just wanted to encourage that. And I also have brought a sample of our very meager attempt to produce accountability for last year. So again, I just encourage nonprofits to showcase the work that they've done so that they can prove their worth in order to maybe collaborate more with other folks and to let everybody know the value of the work that we do. So I'd like to pass these around to everybody. Thank you.
Thank you, Carol. Any other announcements from board members? Okay, so next, I just want to make one announcement. I'm kind of surprised that staff didn't mention this. Shame on you, I know. May 2nd, the 5th District Homelessness Symposium.
Oh, yeah.
Okay, I won't tell them on you guys. Okay, so that is happening May 2nd. Okay, letters of support. Angelina, you should send out maybe a sample, and that way people can help you. And maybe what we can consider for next month is having a legislative update agenda item. So that way, because there's so much going on, and people will know that that's going to come at the end. Okay, so the next meeting will then take place June 27th at 9 a.m. here. Okay, so everyone, thank you so much for your time, for your attention. Great questions, great comments. We'll see you on June 27th.
Erin, is this yours? Oh, okay.